emotions, outbursts, or unwanted, inappropriate behaviors as a result of. They can be all kinds of different things. As always, we're working today from the Dialectical Behavioral Therapy notebook. I have mine over here on the side. This is the one by Dr. Matthew McKay. I don't have any affiliate links to that yet at this time. You can find the workbook by, searching online, any search engine, Bing, DuckDuckGo, whatever. I know Barnes & Noble carries Dr. Matthew McKay's DVD workbook. We've talked before about the evidence behind dialectical behavioral therapy, and you're welcome to go back to the video where we talked about that, or get on the email list where I actually send out the studies about why dialectical behavioral therapy has been shown to be so effective. We're looking at chapter 6, and some of these exercises should be relaxing. Don't mind the kind of humming sounds, okay? Learning how to recognize your emotions and the effect on your life is the first step to controlling your high intensity emotional reactions. Very often people spend their lives paying little attention to how they feel. As a result, there are a lot of important things happening inside them that they know little about. Does that sound about right? Does it sound like, if you're having either unexpected outbursts or the opposite, where you don't display the emotion, where it's kind of being buried, right? Both of those things, there's a lack of emotional awareness, right? So, sometimes people struggling with this problem do recognize the tidal wave of distressing emotions that overcomes them. Sadness, anger, guilt. But by the time they recognize the tidal wave, it's too late to do anything about it. So, first, it's necessary to slow down and take a deep breath with me. Down the emotional process so that your emotions can be examined, right? And then after it's examined, you can make healthier decisions. So, the first exercise, let's consider an example, and then let's go into the exercise. In this example, Ling struggled with overwhelming emotions that often got out of control. One evening, she came home from work and found her husband drunk on the sofa again. He refused to go to the psychotherapy, and he didn't consider himself an alcoholic, so he wouldn't go to AA. Ling immediately felt angry, so she started screaming at him, calling him a worthless idiot. After a few minutes, she did want to hit him, but she didn't. He just lay there without arguing or moving. After a few minutes, Ling started to feel ashamed and hopeless. She had tried everything to help her husband, but nothing seemed to work. She didn't feel like she could stay in the marriage any longer, but she also didn't believe in divorce. So she went to the bathroom, locked herself in. She thought about ending her life to deal with the pain that she was in, but instead she began doing self-harm on her leg with a razor, just enough to bleed. That night she forgot to set her alarm because she was so upset, so she missed the first few hours of work and got reprimanded by her manager. Ling's story is common for a lot of people, and this is very common for people who have borderline personality disorder. other side of the spectrum where you might be will, instead of recognizing and doing some kind of outburst to the emotion, might cope in other unhealthy ways. There's many ways to do self-harm. Eating disorders can result from these kinds of behaviors, or just normal pathological overeating, right? People don't just overeat because they're greedy, often because we are trying to deal with something that doesn't feel good. This can contribute to high blood pressure, diabetes, other things like that. So there are many unhealthy ways we deal with emotions, whether like in borderline personality disorder, where it's common to have this kind of like outburst and then self-hate after the outburst, or similar into some of the, now anxiety disorders aren't usually self-focused, but it is possible in other disorders, or just in somebody who's extremely shy, to just not deal with them. And again, that usually manifests in different physical ways, like overeating, or other hypertensive situations. So, whichever side you are in, let's look at 6 steps that can help you start at least recognizing the emotions. And this is from Linehan, 1993. Marsha Linehan was the person who pioneered dialectical behavioral therapy. What happened was there wasn't a good therapy for borderline personality disorder at the time, and still this is really the only one that kind of helps, right? The only one. So after this therapy was pioneered, it was found to be helpful for other strong emotion regulation issues, right? Your hair is lovely, by the way. Other issues. Scratching deep into your hair. But it was found to be helpful for other strong issues, especially in teenagers, especially when you're talking about the really dangerous behaviors like ending your own life or self-harm, right? So, here are 6 steps. First, ask yourself, what happened? And I know these might seem very basic and silly, but they help you to slow down the emotional process and force you to figure out how to process it in a manner that's healthy for you. So first, what happened, right? You describe the situation to yourself in this example. What happened was Ling found her husband was drunk again, right? Why do you think the situation happened? This is an opportunity for you to identify the potential causes of your situation, right? This is important because the meaning that you give to your event will often determine your reaction to the event. For example, if you think someone hurt you on purpose, you will react differently than if you think it was an accident. Here, Ling believes that he's an alcoholic who hates her and regrets marrying her in the first place. So he's given up on his life to hurt her, right? She takes this personally. That's important. So, and especially when dealing with any kind of anger, right? You want to look at, why do you think this happened? Now, if we were talking about cognitive behavioral therapy, this would be a great time to intervene with those thought remember. Thought distortions are things like generalization, seeing only the good, discount or the bad, discounting the positive, mind reading, telling the future, right? Do you know which thought distortion Ling is doing here? You know? I'll give you a moment. You don't remember? Do you remember? And thank you, by the way, for stopping in and saying hello. Hush. Hush. All of you. Brave. Everybody. So, the kind of cognitive distortion Ling has here is called mind reading. She is assuming why her husband is drunk again, right? She doesn't actually know. She could guess, but she doesn't actually know, right? So, for cognitive behavioral therapy, like I said, that's kind of where. So, and I'm very sorry that you're sore. A lot of the physical stuff that you're talking about really can be related to holding all your anger in a tight little chest ball. So, that can definitely happen. So this can be a time to look at the thought distortion, but sometimes people are too emotionally overwhelmed, especially someone with borderline. Sometimes the cognitive behavioral intervention can be painful because it's like, oh, I'm wrong. Why do I think wrong things? Why am I stupid? And it can become a funny spiral. Not very funny, really. So for DBT, we're just going in order of these questions. But if you can, at any point during the questions, identify a thought distortion, you'll be miles ahead of, everybody else. So why do you think this situation happened? How did the situation make you feel emotionally and physically? Because sometimes, like you're talking about with your cheeks, sometimes your body is telling you how you feel, even if you can't tell cognitively, right? Try to identify both primary and secondary emotions if you can. Do you know what a primary and secondary emotion are? For example, many people, especially those who have been raised to need to be tough, will, instead of dealing with the primary emotion of sadness, have a secondary emotion of anger. That's particularly important to note because anger is often a secondary emotion, especially in cultures where sadness and crying is weak and anger is accepted. If you grow up and your father or whoever, in some cases, I don't want to talk too personally, but sometimes somebody in your life models anger as being an inappropriate reaction and sadness as being a sign of weakness, right? And it can be your father or your mother. People often have angry mothers, and it's overlooked because because the assumption is always like these macho men, but gender can be tied into it, your gender identity. There are a lot of messed up. Part of the reason that we have people not being satisfied with their bodies and being in the bodies that they are is the belief that there is an appropriate set of behaviors basically related to which pair of reproductive tackle you were assigned. So women can be sad, men can be angry. So somebody like me who is predominantly angry will feel like, oh, I should have been born a man. When actually, no, anybody can be either. And this is an imaginary thing that's just causing that gender dysphoria. And instead of acting on the gender dysphoria and endangering myself by doing something to my body, ideally society would change instead, so that, you know, it's understood and acceptable that all genders can be angry, you know, all sexes can be sad, right? So sometimes, as I'm saying, sometimes this can be associated with your perceived, you know, who you are as a man or a woman. So sometimes anger, and it's overlooked because it happens with women too, that like big girls don't cry, right? Big girls are tough, so it's acceptable to be angry instead. So sometimes that's something to think about. Is anger the primary emotion in this case that I'm feeling? Or is there another emotion and I am allowing myself to feel anger only because I won't allow myself to feel the other emotion, right? Something to think about. So this takes practice, but it's worth the effort. So the questions were: 1, what happened? 2, why do you think it happened? And 3, what am I feeling physically and emotionally? Okay. So Link's primary emotion in this case is anger, and then her secondary emotions are shame and hopelessness. Okay. Physically, she notices the muscles in her face and arms become very tense, and she feels sick to her stomach. So there is in chapter 3 of the DBT workbook a list of common emotions, and that may sound silly, but especially people with PTSD often, as I was saying, folks with PTSD sometimes can't even identify. And like, it's difficult because there's this numbness, so it's difficult sometimes even to identify or name the emotion. So there are a number of good emotion wheels available online, or you can email me through the Relaxation Club and I can send you the good evidence-based ones I have from Therapist Aid and other resources. Okay. So, but chapter 3 of the workbook has a list. So you identify the emotion. And all of these things are good to do written down until you get in the habit of going through these questions mentally. So what do you want to do as a result of how you felt? This question is very important because it identifies your urges. Often when a person is overwhelmed with emotions, he or she has the urge to say drastic, painful, or sometimes even dangerous things, right? However, the person doesn't always do these things. Sometimes urges are just thoughts and impulses. When you start to notice what you want to do and compare it with what you actually do, the results can be cause for hope, right? If you can control some urges, chances are you can control other urges too. And that's good hope for somebody with like borderline personality disorder, right? In this example, LinkedIn had the urge to do 2 things that were dangerous and deadly: attack her spouse or die herself. She didn't do either one, and so that can give hope that she can control the other urge of the self-harm, right? And ignoring the problem or the emotion also can count paint your face now. I gotta find my little paintbrush. Because I think that would be nice when we talk about this. Because this can be kind of a long topic. So, that was question number 4. So what did you do? And what did you say? This is where you identify what you did and said, right? So, how did your emotions and your actions affect you later? In this case, the way that Ling coped with her strong emotions was to go to the bathroom and hurt herself. And then the emotions distracted her cognitively, and that affected her at work, right? So that was a problem. So you gotta see the results of your emotions, and sometimes, like I mentioned, the results of what you do about your emotion can cause other health issues. So there's a worksheet in the workbook on page 127 in chapter 6, but you can make your own, and it's basically a sheet where you go through these 6 things. Every time you have an emotion or a strong emotion, carry a notebook around with you, right? And with that, you can start recognizing them. So after you recognize them, what do you do with them, right? And that's important, because sometimes even just recognizing them can put a stop to stuff, right? You can start getting those cognitive behavioral therapy things, like I mentioned on question 2, right? Where you can recognize thought distortions that could be contributing to your strong emotions, okay? So sometimes just doing that, and you get bonus points if while you're writing them out, you also write that out, right? And recognize that you're having a thought distortion. Okay, so you start doing that worksheet. Then, after you've got your emotion record, which when I was in the hospital a couple of years ago, literally had to do that every day for a while, and it was a very, 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 very helpful technique for me. So, now that you're recognizing your emotions more fully, hopefully you're also noticing how your emotions can influence your behaviors and thoughts. There's a little diagram that I'm going to recreate now with my fingers. Like this. Emotions are up here, thoughts are here, behaviors are here, and they're all connected, okay? Your emotions can influence your thoughts and behaviors, and your emotions can be affected by your thoughts and behaviors, right? Okay, here's an example. Jim lost his favorite watch, which is a behavior. He felt sad, which is an emotion. And then he thought, I'm so absent-minded, I'm an idiot. And that's a thought. But the thought also made him more depressed, or it could make him angry, which is also an emotion. And then he might later get drunk, which is a behavior, or overeat and feel ashamed, which is also an emotion. You see how it kind of cycles like that. So you can get caught in these self-destructive behaviors or self-critical thinking that's not helpful. It is always helpful to recognize the ways you can improve as a person, right? So there's nothing wrong with being critical to the point of wanting to improve. There's a verse in scripture, though, that says there's a kind of sorrow that leads to death. It's in Ecclesiastes, which is the most nihilistic passage. There is a sorrow that leads to death, and there's another sorrow reinforce what's actually happening. You're leading yourself to death. You're just becoming discouraged and depressed and miserable because these thoughts are not productive, not helpful. You know, and they're just making you miserable. And that's again why cognitive behavioral therapy exercises are so helpful. So, any questions so far? I'm gonna go through this a little bit more and see if you have any questions. I gotta skip ahead and find the next section for you because I want to answer your question fully. So, and by the way, a lot of times, people with overwhelming behaviors might not approach it directly. They might be passive aggressive. They might manipulate other people, right? That's also unhealthy. That's also unhealthy. I want your... Can you hear this? So weird. I want you to hear me. I hope you hear well on both sides. So, many behaviors are repeated because they're rewarded. You might be rewarded for keeping in your anger and overeating. Instead, you're rewarded by not getting in trouble. You might be rewarded by having anger instead of sadness because people leave you alone. You see, there's all kinds of different behaviors happen because you're being rewarded, and your emotions themselves can be rewards that reinforce your behavior. Here's another example. Phil helped his friend move Stefan into a new apartment. Stefan was grateful, which made Phil feel happy. That's the reward for the behavior. Emotions can also reinforce self-destructive behaviors. Teresa, who struggled with overwhelming emotions, once said, "If I feel bad, I want my husband to feel bad too." Logically, that doesn't make sense. But as a young girl, Teresa, she had suffered alone without anyone's help. No one paid attention to how she felt. But she found out if she caused somebody else to be in pain when she was in pain, she got attention. Now, when she felt upset, she'd go home, pick a fight with her husband about something unimportant, and he'd feel miserable. Then he would finally recognize how she felt and talk to her about her feelings, which was an emotional reward. She may not have been consciously trying to hurt him on purpose, but that didn't matter. They were automatic. It's kind of like, I feel bad, I have to make someone else feel bad, then I'll feel better. And sometimes, like with birds, this is a problem with training birds. Sometimes even negative behavior can be a reinforcement. So sometimes a bird might scream. And this is, again, very applicable to borderline personality disorder. A bird might scream. And then I say to it, "Be quiet." And then it got the interaction from me, even if I'm angry or even if I chase it around to make it be quiet. And it doesn't enjoy that experience. That experience becomes preferable to it, to sitting in quiet and being ignored. So it screams to get more of that reward. That's something we see a lot in actually autistic children who scream. I studied applied behavioral analysis briefly when I worked as an intern doing applied behavioral analysis therapy on autistic kids. This is like 20 years ago. No, not 20 years ago. Like 15 years ago. I did that, and that was a thing that the child would scream to get yelled at, right? And that was pleasurable because at least it wasn't nothing. Whereas if you ignored the scream, they would keep screaming louder and louder as you continued to ignore them. But then eventually they would realize, oh, this isn't getting me attention, and they would do something else. A good behavior repression doesn't mean you do nothing about it. Usually there's something else that you're doing, like just something. And so see what it is you're doing, right? Rushing to the next thing or whatever it is that you're doing. And see, even if it's an absence of action, look at how that thing is being rewarded, right? And then think about the long-term costs and dangers. So things like self-mutilation have obvious dangers that we've talked about before in earlier dialectical behavioral therapy topics. You can get infections. You might make a mistake and hit something and then seriously harm yourself and then be unable to function, right? Overeating obviously has its risks. Lying in bed doing nothing has its risks. Different ways that you cope, avoiding people has its risks. All the different ways that we cope rather than dealing in healthy ways with the emotions, right? They don't have this exercise here, but something that I learned from autism therapy, from applied behavioral analysis, was to replace the behavior with another behavior that fulfills the same need. Let's switch where we are because the sounds of the magic library are overwhelming my ears a little bit. I hope this makes sense, since you asked. So, what do I mean by replacing behavior? In the case of an autistic child who's screaming, right? We're talking about severe nonverbal autism. That was the kind that I would see at that point in time. The child is screaming for attention, so you teach an alternate way to ask for attention. And like the child comes up, taps your arm, and says, "Can we play a game together?" And that replaces the behavior. Or the child comes and gives you a hug, something else. You teach a replacement behavior that fulfills the need that's being fulfilled by the unhealthy behavior. So find a different way to get that reward. You may be choosing to isolate and avoid speaking or avoid paying attention to your emotions because that prevents conflict. The reward that you get is peace, right? Well, what can you do instead? Some people instead write out the emotion and write down, instead of repression, doing suppression, right? The difference between the two of those, repression is an unhealthy Freudian defense mechanism, and suppression is a healthy Freudian defense mechanism. Suppression means you put the item aside to be dealt with later. In the case that we talked about before, about, for example, biological urges like sexual kinds of different things you can do when you're angry that can that can fulfill whatever you are looking for, right? Somebody who has outbursts and what they need is validation, not avoiding conflict, right? Or somebody who's self-harming to get dopamine rushes, or not dopamine, but little endorphin rushes, because you get local endorphins released by tissue damage, right? Somebody like that, you can do intense exercise instead to get the same endorphin, like tissue damage motion, but that's healthy for you instead of unhealthy. Obviously, you don't want to be an extreme exerciser to an unhealthy point, but you can get the same high. In fact, you can get a better high. So you see what I'm saying? Folks with borderline personality disorder often have the problem of the extreme, like extreme reaction. Figure out what the reaction is getting you what you need and find a healthy behavior that replaces it. Same kind of thing if you're at the other end of the spectrum, or even a little bit schizoid. There is a kind of personality disorder called schizoid personality disorder, where you avoid everybody. You don't need any friends, you don't need anybody, and you're perfectly happy with nobody. Those folks almost never get identified or treated because they just don't need people. Now, there are people who don't have that, and they're at the extreme end of what people call antisocial, which is different than antisocial personality disorder. Lay people use antisocial to mean like you're shy or you're a recluse, but antisocial personality disorder is actually what lay people call being a psychopath, like where you like to hurt animals or torture people. So these are terms that are important to understand. They're different. Someone with antisocial personality disorder likes to burn and injure people that fulfills a need for them. But somebody who is antisocial is a little more similar to the schizoid personality disorder profile. Not that everyone who is antisocial has that personality disorder, or that everyone who experiences Schadenfreude has antisocial personality disorder. I hope that made sense. A little bit of personality disorder education for you. But that's the situation you want to find if you're at that other end of the spectrum, where avoidant behavior is rewarded. You have to find something else that can reward that avoidant behavior. I hope that makes sense. Yeah, I figured that was your case. So, sometimes avoidant people will also be manipulative, but not always. Manipulating can also be a reward behavior. So, food, obviously, right, can be a thing. Overeating, undereating, all those kinds of things. Drugs, alcohol. I'll let you think. So, and you can improve these things. Your emotions are chemicals, and by changing the chemicals that are in your body, you can change the chemicals that you experience, right? The food that you eat can directly impact your mood. Your sleep obviously impacts your mood. Whether you exercise, what kind of exercise you do, the intensity of exercise, all of that affects your mood, right? And your mood can affect not just your behavior and those things, but also your physiological responses to them. So it's another triangle or circle at all. All of it interconnects. So one of the first ways that you can deal with inappropriate emotion regulation is sit down and take a good hard look at your food habits, your sleep habits, your exercise habits, and see if with those behaviors, if you can modify those behaviors to better meet your emotional needs, right? And see if you are practicing self-care or self-indulgence. Self-care is healthy for you. helps you to better hone your body and mind so you can be of service to others. Okay? Self-care is selfless. Self-indulgence is selfish. It causes you often to do things like overeat, engage in risky sexual behaviors, or overuse alcohol, things like that. And sometimes we have trouble with the line between self-care and self-indulgence. And there are other people who are at the extreme end, the extreme opposite end, right? And they don't do any self-care. They wear their bodies and minds down. And then the people that they're supposed to serve suffer because there's nobody to serve and fill that position because they're worn down. So you have to take a good look at your self-care regimens and see how they affect your emotions and whether or not you are using them to help and buffer your mind and body so that you are ready for intense emotional experiences, or whether you're using them as escape and using them in unhealthy ways to reward negative behavior. For example, every time you're sad sitting down with a bucket of ice cream, how do you replace that behavior? What's something else you can do to replace that behavior that's healthier? This is where there's another, I know there are many layers and meaning to the passage in the Tanakh that is quoted in Matthew. Lo aleichem yechaye, lo aleichem yechaye ha'adam ki al kol matzot fi Hashem. I think I'm missing a word there, but that's usually translated. Not by bread does the life of man live, but by every word that comes from the mouth of the Most High, right? And you can take that in many more abstract ways. Again, it also applies scientifically in that if you try to nourish your spirit all the time with only food, bread, or whatever else it is you're using, and not with the spiritual things, you don't really live, right? That's kind of the idea. So this is where things like meditation, studying your scriptures, different things like that, like getting in touch with what is important and your place in this universe, right? Those kind of things can be coping mechanisms that can replace unhealthy coping mechanisms, right? So just like exercise can replace the self-harm. You know, every time you get upset, you self-harm, and instead you exercise instead of doing that. That can be replacement, right? Every time you want to avoid a conflict because you're angry, instead you write down what you want to say to the person and come back to it later and see if you want to say that, and then you try to say that, right? That's a good replacement behavior. Every time you feel worthless, and maybe the anger is related to worthlessness, you sit down and read your scriptural passages about who you are and what matters. You paint, you draw, you do something that brings out your inner expression. Sublimation is another healthy Freudian defense mechanism, right? Sublimation is where you do a behavior that fulfills the need but is not the same behavior. For example, an extreme example would be somebody who has antisocial personality disorder and has the urge to hurt or cut people. But this is a good person who doesn't want to live that out. But it's like an uncontrollable urge. So what they do instead, they become a surgeon. So they cut people for good, right? That's an extreme example. I think that that would be a very private example. Some people wouldn't want to know that their surgeon is cutting them for that reason. delicious as like healthy dinner with a side of delicious roasted broccoli and, oven roasted, salted, oiled kale. I'm hungry. Do an alternative thing that fulfills that need instead of repressing it and ignoring it, right? You're angry, write about it, draw about it, go chop wood, run, exercise, like do a thing that releases that emotion. This is why intense exercise, not just amount of exercise, is what's recommended scientifically for depression. Amount of exercise is important for your heart, for high blood pressure. Intensity is what matters for depression. And I haven't seen it studied in other mental illnesses, but it would make sense that it's a similar profile, right? You burn the emotions into different neurotransmitters as your heart rate is up, and your SOD dismutase enzyme has to deal with protecting you from free radicals, and you have that oxidation that happens in exercise that changes all your neurotransmitters. So I hope that gives you kind of an idea. I think we've talked about a lot of things, and I'm going to put this up on the YouTube so you can listen to it later, because it's a lot of things to cover. We talked about going through the emotional recognition process, which those 6 questions that at any time you can stop with cognitive behavioral therapy. We talked about looking at your negative coping mechanisms and analyzing at the root of them what need they're fulfilling. And then finally we talked about replacement behaviors, and we talked a little bit about personality disorders and defense mechanisms, unhealthy versus healthy defense mechanisms, and which defense mechanisms you can look into using, how you can use suppression and sublimation instead of repression to have a healthier and happier emotional life. I hope that was helpful. And if you need to review, of course, in the depression playlist we have CBT. There's 2 different videos on cognitive distortions or thought distortions, the 10 thoughts that are killing you, those kind of things. There's a couple videos on there that can help you also deal with misunderstandings when it comes to anger. And of course we have the earlier DBT video